Okay, hi guys. Thank you for putting up with finishing up this lecture and starting a new one electronically. Let me just make sure that we're working here. Okay, we're all set. Okay, so last class we looked at this figure. It's great. It really compiles a lot of the important adaptations from the perspective of the cardiovascular system. So remember, we're going to see an increase in total blood volume. This is going to be a function of both increase in plasma volume, so that's the liquid portion of the blood, and an increase in red blood cell mass, otherwise known as hematocrit. So remember, this is really where we're going to find hemoglobin and therefore oxygen carrying capacity. So these things together will contribute to increased venous return. So if we have more blood volume, we're going to bring more back to the heart. We see some other things, increased ventricular compliance, so really looking at the ability of the heart tissue to expand and contract. See increase in internal ventricular dimensions, so especially the thickness of the myocardium or the cardiac musculature. So if we have more musculature, we are going to be able to push more blood out of the chamber. And increased myocardial contractility. And this is something I'm going to hint at a couple times throughout the rest of this slide set, but I'm not going to get into the nitty-gritty details because we're going to do that in the upcoming weeks. So essentially, though, your heart becomes better at producing greater force. So therefore pushing more blood out. And that's what we see here. So greater force is going to relate to increased ejection fraction. So the proportion of blood from the left chamber that actually gets pushed out, because remember, you don't push everything out of the chamber. So we also see increase in end diastolic volume because we had more blood back to the heart. So during the relaxation phase or the diastolic phase, we're going to have more blood in that chamber. So then we're going to push out more blood because of these factors. That increases maximal stroke volume or stroke output, so the amount of blood pushed out by the chamber, the left ventricle, in one cardiac cycle or heartbeat, which of course is related to the amount of blood we push out in 1 minute. We talked about distributing cardiac output more effectively, so we're going to increase the amount of blood flow to the active musculature, so the skeletal muscles, and we're going to sort of shunt blood or decrease blood flow to those tissues that don't need it right away because we only have so much blood. So this is going to be shunting blood to, for example, the gastrointestinal tract and some of the other internal organs. And we also see increased optimization of peripheral flow, and so this is especially going to get down to increased microcirculation or increased capillaries, and therefore increased blood flow to the active musculature, which is going to allow us to distribute more oxygen to the tissue. We also talked about heart rate. So remember, we're going to see decreases in resting and submaximal heart rate. Okay, so that's different from maximal heart rate, where we see no change whatsoever because maximal heart rate is solely a function of age. So we can't do anything about that. So this is what we see in figure form here, and this is really where we left off last class. So we see oxygen consumption, or VO2, the relative unit, so milliliters per kilogram of body mass per minute. So we can use this as a measure of exercise intensity. So we increase in exercise intensity as we, as we move to the right. And we can see that before training and after training, these slopes look different. So we see a bigger slope here, a slower slope here, meaning like a more efficient heart. So you don't have to pump, you don't have to beat the heart as many times. You don't have to pump blood out as frequently because you're more efficient. So that's what we saw with lower resting heart rate. We see lower submaximal heart rate, especially, so a greater magnitude here, a decrease in submaximal versus resting heart rate. And I kind of drew a figure on the board to represent if we lower resting and submaximal heart rate, this gives us a bigger range or bigger capacity to perform work. Therefore, we are able to, at least with respect to heart rate, we are able to perform at a higher intensity. Now, why does this happen? This is due to a decrease in the intrinsic firing rate of the sinoatrial node, otherwise known as the pacemaker tissue. So remember, these were specialized cells in the right atrium, the top of the right atrium, that generates the electrical signal to then produce a contraction of the cardiac musculature. So the firing rate, the rate at which that electrical signal is generated, is decreased. So this is what contributes to resting and submaximal exercise, bradycardia, after aerobic training. So I'm sure you've heard of this word, but just to clarify, bradycardia means essentially low heart rate. It's anything under 60 beats per minute. So especially for people who are really well trained, you can get that way under 60 beats per minute. So like we mentioned, the best time of day to measure this is right after you wake up in the morning. And there are some athletes that report bradycardia of even like 34, 38 beats per minute, which is nuts. But most people, if they train regularly, they can easily get that down to like 42, 52 beats per minute. Okay, so what we see here, sedentary college students in the yellow, sedentary college students in the green blue after training, and then endurance trained athletes who are even more trained than our sedentary college students who underwent a training program. So we see a decrease in resting heart rate. We see a larger decrease in submaximal heart rate amongst these groups that allow them to perform at different maximal exercise intensities in the end. Okay, so like we just kind of saw then, we saw a submaximal heart rate for standard exercise decreased by 12 to 15 beats per minute. That's an average. Of course, there'll be variation, especially depending on the level of exercise intensity we're talking about here, because for a given intensity here, we see even a greater difference. There's going to be a smaller change in resting heart rate than submaximal heart rate, and this coincides with an increased maximum stroke volume and cardiac output. So while stroke volume and cardiac output are going up, simultaneously, heart rate is going down. So those adaptations are happening at the same exact time. So remember, if cardiac output is a function of stroke volume and heart rate, stroke volume is going up, but heart rate is going down. Remember, we briefly mentioned this, but this is very important to remember that the magnitude of increase of stroke volume vastly overwhelms the magnitude of decrease in heart rate. Therefore, the net result is that cardiac output increases. Okay, so that was really, thinking about stroke volume going up, that was really thinking about maximal exercise. But if we think about during rest, you're going to actually see that we become more efficient, and I'll show you that shortly. But you see here, endurance training causes heart stroke volume to increase during rest and exercise, regardless of age and gender. So why does this happen? Increased left ventricular volume and mass. We have a greater capacity to produce force. If we have more musculature, if we have a larger volume of the ventricle, we can put more blood in it, and therefore we will push more blood out. Cardiac and arterial stiffness decreases. This is going to relate to increased compliance, so this tissue can expand and contract more. The increased diastolic filling time. So as heart rate decreased, remember the diastolic filling time increased. We had more time between beats to fill the heart up with blood. And we see that the cardiac tissue undergoes some adaptations to produce more forceful contractions. So taken together, we have an increased stroke volume. Now, an increase in maximum cardiac output is the most significant cardiovascular adaptation with training. I've bolded this, I've underlined it, because it is important. This should be a big hint that this is a test question, okay? So this is a huge contribution to why somebody becomes more able to perform aerobically. Now, like I mentioned before, that this, especially when we're thinking about maximum cardiac output, the results directly relate to improved stroke volume. So in trained athletes, especially, cardiac output increases linearly with VO2 throughout the major portion of exercise intensity. So as exercise intensity goes up, cardiac output goes up proportionately. And that should make sense. We need to, therefore, distribute more blood. We need more oxygen. Therefore, we're asking, identical levels of stress of the heart. Okay, so when we think about cardiac output, submaximally, there's going to be a reduction. And this is something that you see, it's very standard with exercise physiology. We tend to increase maximum and tend to decrease submaximal responses a lot. And that really represents a more efficient system. If you don't have to perform as high of work at a lower intensity, that means that the system's more efficient. So this reduction is sort of minimal. It's not like a huge reduction submaximally, but it is noticeable. And actually this figure doesn't do a great job of representing that, but you can see it in a couple areas. So with the most trained people in the purple, second most trained in this green blue, and the least trained in the yellow, you can see there are some slight variations at rest there. But when we start looking submaximally, you see that there are points at which that relationship holds true. So especially those that are really trained, you can see that they are more efficient. They do have lower cardiac output at these submaximal exercise intensities compared to the other two groups. But with this training, and this was really only a few weeks of training, you do see some points at which they are more efficient. So, especially within this range. And nonetheless, it allowed them to perform a greater range of work, right? So they can continue to perform at a higher exercise intensity here. Now, why does this happen? More effective blood redistribution. So we're getting better at bringing blood to the active tissues. We're getting better at bringing blood back from those tissues to the heart. And the trained muscles enhance capacity to generate ATP aerobically at a lower tissue oxygen concentration. So the tissues become more able to produce ATP even though there's not a lot of oxygen there available to them. And we're going to continue to talk about some of these relationships and why this holds true when we discuss acid-base balance. We talked about the AVO2 difference previously. So remember, this is the arteriovenous oxygen difference. So at any given time, no matter who you're talking about, you're going to have more oxygen in the arteries than the veins, of course. Now, as we start to exercise, we're going to have even less oxygen in the veins because we're dropping more of it off at the tissue. But as we train, we're going to see that there's even less oxygen in the venous blood. So as we become trained, we drop off more oxygen at the tissues, and therefore the difference between the oxygen content in the arteries versus the veins is going to get even bigger. So a bigger AVO2 difference with training. So again, this comes back to some of those things we talked about before. More effective distribution of that cardiac output to the active muscles and the ability of the muscles to extract and process available oxygen. So especially with extracting, we'll talk more about that relating to acid-base, but remember, in order to process it, we need more mitochondria. As we said, we will increase the size and the number of mitochondria. Therefore, we're increasing the amount of metabolic systems to generate ATP with this oxygen. We're also going to increase the enzymes of those systems, right? So in general, we can process more available oxygen. Now, blood pressure does increase during exercise. We've mentioned that in the past, and really why that happens, or the contributing factor, is largely systolic blood pressure. So there's going to be a greater increase in systolic blood pressure than diastolic. Now, this figure is very simplistic, but I want to mention that a lot of times you will see a slight increase in diastolic blood pressure, but it's not going to be nearly as much as systolic. So as we train, blood pressure will go down in general. And the largest reductions will be seen in those that were already hypertensive. So if you have a greater increase, you have a greater chance to see a decrease after training. So you will see a decrease in blood pressure in those that were not hypertensive before training, but you will definitely see a change in blood pressure in those that were originally hypertensive. Now, that being said, in medicine, there are always non-responders, right? So this could be non-responders to pharmaceuticals. This could be non-responders to things like exercise. And this is one that tends to pop up quite a bit with non-responders. So there are some people that after training will not see any, or they'll only see very little blood pressure reduction. Now that's rare, but it does exist. So this is a summary figure to kind of show the different categories of factors that limit VO2 max or really contribute to aerobic performance. So we have ventilation aeration, which really represents the pulmonary system. So remember, not typically an issue unless we're talking about an unhealthy person or an elite athlete that is performing maximal exercise intensity. We'll get into some of these details when we get to the pulmonary system. Now, with central blood flow, we're really talking about those changes at the level of the heart. We're talking about blood pressure changes. We're talking about more oxygen carrying capacity with hematocrit hemoglobin. Active muscle metabolism, we're going to continue to talk about. So I'm not going to really reiterate some of these changes. So especially when we get to the muscle section, we'll talk more about those. And then remember, with peripheral blood flow, we're really distributing more effectively. We have a greater capacity to change the vascular diameter. So this is both of the arterial and the venous vasculature. So remember, both of these do have a small amount of smooth muscle. There's more smooth muscle in the arterial vasculature than the venous vasculature, but therefore we have more control over where we're distributing blood flow. Now, I like this figure because it really compiles a lot of the variables that we see that change with aerobic training. So On the y-axis or the x-axis, we see training duration in months. So this goes from 0 to 2 years and then 6 months of no training after that. And this is an arbitrary scale to really normalize these variables since they all have different units. So you can see from baseline to just a 2-month time point, these are all increasing, but at slightly different rates. So especially the aerobic enzymes are increasing more rapidly than are some of these other factors. But nonetheless, we see drastic increases, at, several months later with aerobic enzymes. So remember, those are the enzymes in glycolysis, in especially the Krebs cycle and some of the components of the electron transport chain. The fast twitch fibers. So these are fibers, are type 2 fibers that normally aren't relied upon much for oxidative potential. So they're more geared towards fast production of ATP, really powerful contractions. But nonetheless, they still do perform aerobic metabolism to produce ATP. And they will also increase their ability, their oxidative potential, their ability to generate ATP aerobically, meaning in the presence of oxygen. Increased glycogen stores, increase in microcirculation or capillaries, increased VO2 max, increased cross-section size of slow twitch fibers. So these are our fibers that are normally, we think of with aerobic metabolism, right? So this is really relying on oxygen to generate ATP. So we'll see an increase in the size of those fibers. Not huge increases, not to the extent that we would see an increase in a fast twitch fiber, but they still will increase in size. So we'll get into more of the details when we get to the muscle section here. So it's probably not surprising then that those variables that had a more drastic increase will also have a more drastic decrease once you detrain. So they're all going to decrease and get back down to baseline at 6 months, perhaps even a little bit earlier than that with some of these variables. And remember that this kind of goes back to the principle of the adaptations with the general adaptation syndrome. So if you recall from that figure of the general adaptation syndrome, we needed to provide another stress, another stimulus in order to keep these adaptations around. And so if we don't, we lose the adaptation. And this is amazing. Your body's really efficient, right? So it's not going to keep around any tissues or any enzymes or anything like that if they're not being used. So your body's very efficient. It's not going to use up ATP to maintain these systems if there's no need for that. Okay, so this finishes up where we left off last class. I'm going to end this session and I will start a new one with the lecture that we were supposed to go over today.